My name is Dr. Christopher Bailey. I'm a consultant anaesthetist in Ysbyty Gwynedd Bangor, and I'm going to talk to you about what you can do to improve your recovery after major orthopaedic surgery. You will already know or have learnt from other talks that it is our responsibility as your anaesthetist to care for you during your operation. However, we also have additional skills that will hopefully improve and shorten your recovery after major surgery. This includes trying to get you as fit as possible before surgery, therefore minimising any complications you may have. And for those higher risk patients, we may be involved in caring for you on the high dependency unit after surgery. Anaesthesia and surgery are both very safe. There are approximately 10 million surgical procedures performed in the UK each year. The vast majority of patients have uncomplicated surgery and go home either on the day of surgery or very soon after. However, we know that a proportion of patients will experience a complication after surgery. We are often able to predict which group of patients will experience a complication. Therefore, it is very important that we get you as fit as possible before surgery to try and avoid this from happening. Avoiding a complication will obviously benefit you as an individual, but it will also benefit the hospital, in that it allows us to care for more patients just like yourselves. As part of your preoperative assessment and workup, the preoperative team in Ysbyty Gwynedd will look at your individual medical conditions and, where possible, optimise them. This will involve checking if you're anemic, thus reducing your risk of having a blood transfusion and improving your recovery time. Checking your blood pressure. Your blood pressure should be controlled to safe levels to reduce the strain on your heart and minimise your risk of having a stroke. And if you're diabetic, controlling your blood sugars, this reducing your risk of having an infection after surgery. I'd like to emphasise how important it is to control known medical conditions as well as possible and as early as possible before surgery. This will improve your chance of recovery and minimise your risk of complications. For some patients, we may need to postpone surgery if these conditions are not adequately controlled before surgery. Now that you've been booked for surgery, you might think that there's not much for you to do while you're waiting for your operation. Wrong. When it comes to your health, you are the single most important person, and there are many things you can do now to reduce your chance of having a surgical complication, therefore allowing you to go home sooner, hastening your recovery so you can enjoy the things you did before surgery sooner, and improving your future health. It's important that you consider how much you smoke, if you do smoke, how much alcohol you drink, your diet, your weight, and your activity levels. Smoking. We recognise it is difficult to stop smoking, but the benefits for your health is unquestionable. Even if you stop smoking for a few days or weeks before surgery, this will reduce your chance of having a complication around the time of your operation. By stopping smoking, you'll reduce the amount of carbon monoxide and nicotine in your blood, thus improving the ability of your blood to carry oxygen and reduce the strain on your heart. If you'd like support or would like to know more about how to quit smoking, please click on the link below. Alternatively, ask your GP or practice nurse or at your preoperative assessment. You're more likely to succeed in quitting smoking if you ask for help. I'd also like to remind everyone that Ysbyty Gwynedd and BCU as a whole have a strict no smoking policy. Smoking on hospital grounds, even outside, is not permitted. Please respect our request. Alcohol. Alcohol can have many effects on the body. Importantly, it can make the liver less able to make the building blocks needed in order for the body to heal after major surgery. It is safest not to drink more than the recommended limit of 14 units per week, and this applies to both males and females. Exercise. Immediately after surgery, your body needs to deliver more oxygen to the part of the body that was operated on in order for it to heal. This creates an extra demand on both the heart and the lungs that is sustained for many days after surgery. We know that fitter patients experience less complications than those that are less fit. We therefore recommend that you increase your activity levels while waiting for surgery. Swimming, running, or brisk walking 3 times a week or more can make a big difference. We understand it might be difficult for you to exercise, but please try and increase your activity levels safely where possible. Your diet. Your body needs to repair itself after surgery, and eating a healthy diet before and after surgery can help this process. If you're overweight, reducing your weight preoperatively can have many benefits that include reducing the stress on your heart and lungs, reducing your risk of blood clots, and reducing your chance of having a wound. So nothing I've said will hopefully come as a surprise to you. but hopefully it will motivate you to make the changes necessary to reduce your chance of having a complication around the time of your operation, reduce the time you spend in hospital, shorten your recovery time, and more importantly than anything else, improve your future health. Thank you for listening.